Hi, guys, and welcome back to the IBS Freedom Podcast. I am joined by I'm running out of descriptors, but fabulous co-host, Amy Hollenkamp, RD, is here with me to talk all about low stomach acid. Ho, ho, ho. This is going to be a good one, I think. Amy, care to start us off in some way? Oh, but first, sorry to cut you off. We are trying to record this on a different platform than we normally use. So if you're watching us on YouTube and it looks particularly squirrely or grainy or weird, apologies. If it looks totally atrocious, we're going to go back to our other platform next time. But I wanted to give this one a go. So without further ado, Amy, care to kick us off?
Yeah. So low stomach acid's a fun topic in general, just because I tend to see it focused on. I definitely think people talk about low stomach acid, but a lot of times they're not necessarily diving deep enough. From my standpoint, they might be doing some strategies to help increase stomach acid, but a lot of times they're missing some of the key strategies to boost stomach acid and to stabilize stomach acid. So I think that's like my main frustration and a big point I want to make in this podcast is just, supporting stomach acid's great and can be helpful, but really digging deeper as to why your stomach acid might be low, I think's probably the most important question. So not just stopping at like, let's supplement with HCl or take some bitters or things that might help with stomach acids. Those can be great, but it shouldn't just stop there.
Yeah. Yeah, and that's one of my frustrations with it too, is I feel like the integrative community and like the, nutrition community oftentimes doesn't go deep enough. And it's just like, oh, low stomach acid, bada bing, bada boom. Take your pill, you're good to go.
Right.
Off into the rainbow, living your normal dysfunctional life, off you go. And then my other frustration is it's almost like it's talked about, dare I say, too much in the integrative space, or it's overemphasized sometimes in the integrative space, and that it is completely, utterly ignored in the conventional space, right? So like, you go to a conventional GI, if you ask about low stomach acid, they will probably tell you that's not a thing, or, that you're not going to have it unless you're like 80 years old. And then you go to an integrative doctor or a nutritionist or a chiropractor or a naturopath, and pretty much 99% of those people are going to tell you that you do have low stomach acid. So it's like, well, which side is correct? And again, we said this in so many podcasts already. You and I feel like are forever in the middle zone of, hey guys, like, let's try to think critically here. And take it on a case by case basis. No, not everybody has candida. No, not everybody has low stomach acid, but it can be a pretty big part of somebody's healing journey.
Oh, I totally agree. And it's always funny to me thinking of us in the middle, because I feel like, I don't know, we might upset some functional medicine people and also upset the conventional medicine people. But I think, again, like it definitely is trying to figure out what could be affecting the stomach and what could be driving the lower acid to begin with. I think so key to hone in on. And you're totally right. The conventional side of things only sees high acid as a problem, unless you are like in your 80s. They might mention it, but even at that, they probably won't. So yeah, and I would say most of the people I've worked with have tried some sort of like stomach supportive thing. I don't know if that's kind of the same with you. Most people have maybe tried HCl or tried like some bitters or tried some apple cider vinegar or something to kind of rev up stomach acid in some way. What do you find that most people are trying for low stomach acid just kind of out the gate? Is that similar to what you're seeing?
Yeah, I think a pretty fair whack of people that I've worked with have tried something. I would say that a lot of people have dabbled, but they maybe haven't gone about it in quite the way I would have. Yeah. I do see a fair number of people who have tried the apple cider vinegar with meals. And for those of you who are not aware, the idea being is that vinegar is not only acidic, but it's also a high histamine food or drink, food, liquid. So either whether we're going with the theory that the acidity of the vinegar itself is changing the pH of the stomach, which personally I don't really buy, because it's a drop in the bucket compared to stomach acid, Or if we're saying, oh, if you consume that high histamine vinegar, then that turns on that system and you get more HCl production because of that. Either way, the idea is that if you take like a shot or a tablespoon of apple cider vinegar before your meal, that stimulates stomach acid production or it acidifies the stomach. So that's kind of the general premises. What's nice is that it's really cheap and it's widely available,
Right.
and it's usually reasonably well tolerated by most people unless you have some blatant histamine intolerance issue. I don't know if I've seen it be tremendously helpful for a lot of people, but I find that a lot of people have tried it. Now, let me ask you this, because I've observed something, and I want to know if you've observed the same. There are two ways to test for low stomach acid. I'm using quotes because it's never that clear, but there's two ways to test for low stomach acid that are talked about in the integrative space and in the forums. I'm curious which one you've seen people do more on their own. Have you seen people do the baking soda test, where they mix the baking soda and water, drink it down, and wait and time how long it takes them to burp? Or have you seen more people do like the ever increasing dose of HCl until they get reflux? What do you see people do on their own?
I've seen both. I will say the baking soda one, more interestingly enough, I've seen people have really bad reactions to it. I don't know if that's something that you've seen before, but I've had two clients now who like had horrendous like gut issues after doing the challenge. It wasn't a guided thing. They tried it on their own. And I've kind of taken note of that. So I'm a little careful, I would say, with the baking soda one, the baking soda challenge. And again, I could see if that's sort of squelching the stomach acid you do have in some way. Maybe that's driving some of the symptoms that were precipitated in those cases. But I've definitely seen people doing the HCl capsule challenge as well, which I think could be helpful. I just wouldn't. I want people to be guided in that.
Yeah, I agree.
Because I just don't want people to think like, okay, I need 8 capsules of HCl with each meal now, and it's like you're going through a bottle of Betaine HCl in like 5 days at that dose. Yeah. So that would be kind of my. But I've definitely seen both being done. Do you see one more than the other?
Yeah, I don't know if it's like selection bias or, the area of the country I'm in, but I've seen quite a few more people do the baking soda test. And they'll report back to me and we'll talk about, digestive juices and stomach acid. And they'll be like, well, I did the baking soda test and it took me 5 minutes to burp or 4 minutes to burp or whatever. And I'm like, I personally don't think that was a valid test.
Yeah.
I don't think it's a valid test.
I agree. And again, like I said, I've seen some pretty bad reactions to it. So I kind of am leery of that to begin with.
Yeah. I don't think I've had anybody who's reported that they reacted poorly to it yet, knock on wood. I don't really recommend this. So I don't know for my own patients either, just people who have come in and tried it.
Yeah.
I've had a couple of people who had an adverse reaction to the other test where people, you start with a low dose of HCl and then you increase progressively. I've had some people respond poorly to that and get reflux. And I think the issue with them was that they started out at too high of a dose and they progressed too quickly because the reaction ended up being acid reflux that persisted for, a couple of days or a week. So I do think you have to be cautious with that one. You have more of a chance of really aggravating the stomach locally, but I think that with the other test you probably have more of a potential to aggravate the intestines and all of the downstream stuff that relies on stomach acid to set it off on the right foot. So they could both be tricky. Have you ever in your clinical career seen a GI doctor or talk about low stomach acid or do the Heidelberg test? I know that they do have an actual test for low stomach acid where I think you swallow a pill, right? But I don't know of any GI doctors who do the Heidelberg test. I know it's a thing. I just don't know anybody who does
seen it like 2 times maybe.
Really?
I have seen one, I think might have been an international client that I was working with. So I don't know if that kind of had anything to do with it either. I think I had one US client that had the Heidelberg test, which is always interesting to me. Like, how do you get that run? Like, was it more of a functional style GI doc or what? But it's not, I don't know if it's a hard test to run or not, or if it's expensive or just not widely available. I don't know all the ins and outs of it. Yeah, just kind of not, which it's kind of wild to me that like PPIs are so overly prescribed that if it is a stomach acid thing, why isn't the Heidelberg more common? I smell something fishy going on
wholeheartedly.
Where
I think it would poke holes in the theory that everybody has too much stomach acid, and it would take away from some pharmaceutical
right, exactly. So I think it's a bummer. It's the same thing a lot of times too with things like SSRIs as well. Like, which again, like, I don't necessarily know the accuracy of neurotransmitter testing either. But like, you'd think that they'd at least look at levels before being like, hey, your serotonin's low, just like out of the blue. So I think it's one of those situations where it's a bummer that stomach acid is never really tested in a totally diagnostic type way. It's a real shame. I wish it wasn't that way.
Yeah, I agree. I think conventional medicine has the ability to test stomach acidity, but they just don't. And again, we don't know. Is it terribly expensive to run? Is it poorly covered by insurance? Is it just that, like, do GI doctors not know that this test exists? Like, I don't know. But for whatever reason, it's just not a commonly ordered thing. So if you're curious about the idea of low stomach acid, or high stomach acid for that matter, you're really left up to this trial and error process, which can be very insightful, maybe a little bit risky. Again, like, we both have had patients or clients who have reacted poorly to each of these tests. But it's like, you have to work with what you've got if you can't find somebody who could do the actual test. And you can hypothesize based on your symptoms too.
Right.
Now oh, sorry, you were going to say something.
I think too, sometimes you can hypothesize based on other lab markers as well. Like, sometimes if elastase is low and you have H. pylori or something showing up on your lab, you can kind of assume that stomach acid might be low. Sometimes certain patterns of bacteria on stool tests can kind of indicate that maybe digestive capacity isn't great. And again, symptoms for sure. I think you kind of want to look at the whole context of the presentation of symptoms, other markers, maybe doing some self-experimentation, but kind of taking the whole context of how everything's shaking out before kind of seeing what's going on.
Yeah, and I think that's a really valid point, that you can kind of you could deduce that this is more likely to be a thing for you based on some testing. So let's actually take a few minutes on that first, and then we can talk about symptoms of low stomach acid, because you can tell quite a lot from symptoms. It's not the be-all, end-all, but you can get an idea of that. And then we'll talk a little bit about how to best try to test for this and, use of supplements. But for testing, I think you hit the nail on the head, that if your other digestive juices are showing up low, like if elastase, for example, a pancreatic enzyme, if that's showing up low in stool, then there's a higher likelihood that you're not getting that signal from the stomach, right? Because normally the stomach is very acidic and it squirts out very acidic juice called chyme. And it's that acidity of the chyme that triggers a reflex in the small intestine that tells the pancreas and the gallbladder, hey man, we need some juice to neutralize this acid. And one of the juices that gets released is elastase, another one's bile. But it's that local trigger of that reflex to tell your small bowel, hey, this acidity is going to kill us. You need to release something else to neutralize that. So I do think that's one potential way. You mentioned microbes. And the idea with that is that if certain microbes, like the two that I always look for are Staphylococcus and Streptococcus, and there's other ones that sometimes can pop up, and I'll let you weigh in on that in a sec, but if there's bacteria getting through to presumably the colon and the stool sample that shouldn't have been there in such an abundance, like staph and strep that are local residents on the skin and the throat, then we can kind of deduce that they must have gotten past the acid barrier of the stomach, which means the acid barrier wasn't much of a barrier at all.
Yeah.
So those are the two biggies I like to look for. Are there any other bacteria that you keep your eye peeled for?
Those are the really big ones. And again, I think H. pylori I mentioned, like,
oh, yeah.
definitely has the capacity to lower stomach acid. It's the obvious one. I think strepto and staphylococcus, again, are going to be, I think, not something that people look out for as potentially being lower for stomach acid. So I'm glad you brought those up. But yeah, I think H. pylori is one, and you usually see, I mean, at least in the stool tests I've looked at, you can kind of see, high strepto, a little bit elevated H. pylori, low elastase. You can kind of see the pattern, which is kind of what I try to look out for when it comes to spotting the low stomach acid stuff.
Yeah, exactly. There's usually not one clear indication screaming at you, hey, low stomach acid. But if you could piece together either, blatantly low or blatantly high or like subclinical or suboptimal test results, you can kind of pick up on this pattern. The other one, and I don't know if you've seen this, I know like when I was ordering a lot more GI map stool testing for my stool test of choice, side note, that's not really my favorite anymore. But I know in their interpretive guide that they give clinicians and people who order the test, they make a point of saying that enterococcus can also be elevated in situations of low stomach acid. And I think maybe there was others, but I don't remember off the top of my head. I don't know. I know for sure when I was reading about it, it made sense that staph and strep could be elevated as a consequence of low stomach acid. I don't remember the logic with the enterococcus being elevated, if it's the same kind of like, maybe it's a resident of the oral cavity or a resident of the skin and you're swallowing it and it's getting past the stomach acid barrier, but I would assume it's probably a similar logic. So that's another possibility.
Yeah, no, totally.
Yeah. Okay. What about other tests? So I would say too, I've had a couple of patients where we talk about this in the context of either iron or protein or a B vitamin, just knowing that you need stomach acid to break down and absorb those. If I see low protein or low blood urea nitrogen, BUN, or, low albumin or something like that on blood work, my initial question is always, do you ingest enough protein? Like, are you a vegan or a vegetarian, or are you somebody who eats meat, but you only eat meat or protein like one meal per day? Like, are you getting adequate intake? And if the person, like I've had many patients who are like, no, like I eat a ton of meat. I'm like, okay, well then that's weird. You shouldn't have low normal protein on a comprehensive metabolic panel. Like you shouldn't have low normal protein if you're eating meat 3 times a day. Like that's just, that's not in line with what you would expect. So then we deduce you must not be absorbing it and breaking it down adequately. And then we look to the stomach acid.
Yeah, same thing with, again, you're mentioning iron. Like I definitely see sometimes like I'm looking at someone's intake and it's like they're definitely eating red meat and things that should be pulling their iron up. And it's not like they were vegan or something and just started eating red meat. It's like they've been eating red meat for a while. They eat other sources of iron. Maybe they've tried iron supplementation, but like nothing's budging their ferritin or their iron levels. Like I definitely think that's oftentimes a big sign as well. Yeah.
And you want to make sure that those people, for those of you listening, like you also want to rule out more insidious things like Crohn's or celiac disease or things that will cause blatant malabsorption. Even SIBO can deplete your iron in and of itself, but you need stomach acid to break down your iron and absorb it and take it in. So if you see a pattern like that where you, honest to goodness, think that you're ingesting enough and you've tried to track your intake with something like Chronometer or an app and like you double check and make sure, no, I'm really, truly, honestly ingesting enough iron or protein, but your levels don't reflect that, then I would start to think more about the stomach acid thing.
Yeah, for sure.
Yeah.
For sure.
I think those are the biggies I look out for. other nutrients, I know that PPI use is associated with deficiencies in calcium and magnesium and B vitamins. So maybe similarly, if you can look at the pattern and you see like low normal calcium, low normal magnesium, low normal B12, like you can kind of piece it all together. I think that they're a little bit less of a dead ringer for this. I think like the iron and the protein and some of the stool test markers would tip me off a little bit quicker than that because, so many people are magnesium deficient anyway.
Right.
That's almost too broad now.
Yeah, I agree. And I only was just going to add, I'm sorry, I didn't mean to cut you off, that magnesium is actually needed to make stomach acid as well. It's a component. So it's interesting that PPIs deplete that. And then also coming off the PPI, you might not be able to rev up stomach acid as well.
The plot
so magnesium's, right. Magnesium's definitely one that I sort of think needs to be in a good range to have healthy stomach acid levels to begin with too.
Yep. Yeah, that's a good point. And for that matter, also zinc.
Right.
Again,
for sure.
And honestly, this is something, and I'm going to just, before I say what I'm going to say, I'm going to make a point of saying this. I'm going to preface with, I was a vegetarian for 11 years. So I know the deep disdain that vegetarians and vegans have when people say, are you eating enough protein? Or you're going to be deficient in B12 or zinc or iron. Like, I get it that that's like nails on a chalkboard to you if you are a plant-based eater. I was there for 11 years. But what I will say, as somebody who has eaten that way, and now I do eat meat, and I do this for a living, it is genuinely, honest to goodness, very easy to become deficient in B12, zinc, and protein and iron on a plant-based diet. End of story.
For sure.
And, you can kind of deal with like your inner feelings of what that brings up for you, but it's pretty hard to get adequate B12, iron, and zinc in particular if you're on a plant-based diet. Protein you can kind of finagle a little bit easier, I think, but the other nutrients, unless you're supplementing with them, it's a little dicey. Consider having a multivitamin that has all of that stuff in it, or consider, once or twice a month having some mollusks or having, clam chowder. I don't know. Like, you do you, but think about incorporating that into your diet in some way, because I do think you'd be hard pressed to get all of this from plant-based sources more often than not.
Right. I concur. I wholeheartedly concur.
You heard it. The dietitian concurs.
Yes.
Yeah. Okay. So now, all right. So that was a kind of glimpse of testing that might tip you off to this being a problem. Now, what about symptoms? Symptoms of low stomach acid. And this can run the gamut, right? Because it's almost like
it really can.
If you have IBS, maybe you have low stomach acid. End of story.
Right.
We're good.
Right. I think, like we've talked about, I think on the last podcast we did on like acid reflux, gastritis, that sort of stuff. I think with low stomach acid, it just kicks off digestion. So, anything downstream could certainly be affected. Yeah. I think what I typically see with low stomach acid, I hear a lot of times like immediate bloating or like feeling of early satiety, feeling like you just sort of ate a bowling ball type symptoms, a lot of burping. I hear, again, sometimes things like acid reflux too, if you're just kind of not digesting things well. I definitely I think the biggest thing that I hear and try to keep an eye on is like the burping, sort of the immediacy of the symptoms coming up, especially if it's like at breakfast that they eat and they just feel awful like the second they eat, and it's just hard for them to get calories in. Sometimes a symptom of like struggling to tolerate things like protein or higher protein meals can be a big symptom. Those would probably be like the main like really obvious ones that I see. What about you? Anything to kind of run with from that.
Yeah, I think you hit the nail on the head. In particular, the intolerance or apparent intolerance to higher protein meals, particularly animal protein. Now, and this is the thing too, is that can also be a symptom of not adequately chewing your food. And that's a piece of the low stomach acid thing. Like, you're not going to make stomach acid worth a damn if you're not chewing your freaking food. So we'll come back to that when we get to like what you actually do about low stomach acid. But I do find, I mean, I've had patients who have told me in their intake forms or in the appointments that they became a vegetarian or they became a vegan because they didn't seem to tolerate animal protein. Like, they would eat chicken or they would eat steak or they would eat, whatever. And they would just get this like indigestion, blah, or like you said, bowling ball, I usually say a brick. Like, there's a brick of lead in your stomach just sitting there and not moving. And eventually people put 2 and 2 together and they're like, okay, I guess I don't tolerate meat. And then they just get rid of meat. And it's like, well, you probably could tolerate it if you actually had the stomach acid to break it down. That was the problem all along. So that's a big dead ringer to me. I tend to see more what I would call indigestion rather than reflux, although I've definitely had people who have what they think is acid reflux, and they have like the burning and the acidity feeling, and then it turns out they have low stomach acid, which is totally like mind-blowing for a lot of those people because they've been told for God knows how many years that they have too much stomach acid and they need Nexium and whatever else. So I see that too, but I think more frequently it's this indigestion and this like blah and feeling like the food's not moving, or like early satiety and like belching and just kind of like blech feeling after you eat. I see that quite a lot with low stomach acid folk.
Another one just to another one just to add to that I'm thinking of is like sometimes nausea. I definitely have seen that too with like lower stomach acid. Again, I feel like it's just kind of that blah feeling like you're describing. Nothing's really moving. Things are just kind of sitting there. You don't necessarily feel good immediately after eating. Sometimes if it's like more SIBO related, it takes a little bit of time to really experience the symptoms. Whereas the low stomach acid tends to be more immediate upon eating. Agreed. And kind of upper in the GI tract for sure, obviously, if it's stomach.
Yeah, I agree. And I do think the immediate reactions, like if you eat your first 2 bites of food and you already are feeling full, or you're eating 2 bites of food and you already feel blah, that's a pretty dead ringer for low stomach acid. Because again, it's like, you chew, hopefully, and you swallow, and then the food, it's almost like it has nowhere to go. It just camps out in the stomach, sloshing around with like a liquid that's not acidic enough, and your poor stomach is trying to process that, but it doesn't have all the tools for the job. So, versus, at least theoretically, if you had something like SIBO or dysbiosis in the colon, you would have to wait for that food to get further downstream and actually make it to the small intestine or the colon. So if it's like, couple bites into the meal or very shortly after the meal, I would tend to think more upper GI. If it's, 30 minutes or an hour or 2 or 3 hours after you eat, then I would start thinking more intestine related as far as like the specific symptoms go. Yeah. I'm trying to think. I feel like there might have been another one that I'm leaving out of my brain, but I'm trying to think of what the other ones were. So we talked about intolerance to meat, particularly, or high protein. Indigestion, although acid reflux can be assigned to. I agree. Nausea, I think, is there. Bloating. Also, I know a lot of my patients who have a lot of bloating, the bloating can greatly improve when we start to do the stomach acid kind of work. I think those are the biggies, at least for now. I would say, too, if you're a person who has been on a PPI or, Zantac or some sort of acid suppressor, or if you are a chronic Tums popper, you have low stomach acid because that's precisely what those medications are doing for you. You wouldn't take them otherwise. So without a shadow of a doubt that you have low stomach acid if you're on one of those medications. So that's another one as well.
For sure. And in terms of like raising stomach acid, there's definitely things that I think are supportive, and we've sort of mentioned them, things like HCl bitters. and we can talk a little bit about those. I do want to definitely talk about like what are some of the deeper roots that could be happening with low stomach acid. And you can kind of kick us off there too.
Yeah. Well, we talked about two good ones already. So magnesium deficiency and zinc deficiency would be two good ones.
For sure. Yep.
I think the bigger one, we should just like put a star next to the vagus nerve episode, because I feel like everything we talk about is going to go back to that.
It all ties back.
Yeah, it all ties back. Because really, your stomach doesn't just make stomach acid for shits and giggles. It's not like your stomach is sitting down there and saying, ooh, I feel like making some HCl right now. Like that's not how it works. Your stomach has to get the signals from somewhere else, namely the brain and the nervous system, in order to know what is expected of it and what's needed. Like, oh, brain says that we're starting to eat now. I'd better do my job and make some acid. But if we are going through life scarfing our food down, chewing each bite of food twice, eating in the car, scarfing, and like eating at irregular sporadic times, and like basically not giving our body and our stomach a heads up of what's actually going to happen.
Yeah.
Your stomach has no kind of concept of what's expected of it. And I tell my patients sometimes, and in my courses, I talk about, you can almost imagine your stomach as like a desk worker, like in a cubicle, you know, and it's got its computer, it's typing away on the computer, and then you, the stomach's boss, or maybe the brain, I don't know, follow the metaphor in whatever way you wish. But you come along one day, Tuesday at 11 o'clock, and you dump like 87 project files on the desk of this poor stomach, and you're like, here, deal with this in 1 hour. See ya. Bye. And you peace out. And the stomach is like, my boss is the worst. I had no idea that this was going to be demanded of me. I have no support. I had all these other things to do. I'm so overwhelmed. And then what happens in that scenario is the stomach does its job in a haphazard, half-ass way. And then it's half the stuff you just threw into the stomach doesn't get digested properly. And now you're chucking a bunch of weird stuff at the intestines and hoping that they know what to do with it. Instead, if you eat at regular times of the day, like if you always take your lunch between 12 and 12:30, I would like to think that the body has some mechanism where like at, 11:30, quarter of 12, out of sheer habit, the stomach in this metaphor is like sitting at its cubicle and it's like, oh, the boss is going to bring me a bunch of projects in 20 minutes. So I'd better like get all this other crap off my desk. I'd better call Suzanne, tell her I need her help. I don't know. Suzanne's the gallbladder. I don't know. But like the stomach can start to prepare for that job and make sure that it's capable, like it has all the highlighters it needs, it has all the sticky notes, it has whatever. And that way, when you, the boss, bring in all these project files, the stomach is like, okay, cool, I can do this. And you can just like, boom, 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 go through and process everything. So I think eating at approximately the same time every day and trying to have a regular eating schedule is really important. And also just like chewing your food and experiencing your damn food. Smell it, see it, taste it, like think about it. Don't scarf it down in 2 bites and hope for the best. Like give your gut brain axis time to actually kick in and do its damn job. And then again, the stomach and the metaphorical cubicle is going to have a much better capacity to do the job that you want it to do.
Yeah, I love that analogy. I think meal consistency is something that's not really talked about enough in the gut health space. Yeah. There's a lot of talk, about fasting between meals and those sorts of things with meal patterns. But I think meal consistency can be really huge. I think for most people that have gut issues, having that consistency in your body being primed almost to digest at certain times, your body can start to prepare things. I think you're totally right about the vagus nerve and the brain-gut axis. I mean, digestion and the stomach acid equation isn't any different than other aspects of digestion too, where it's all brain-based, nervous system-based. So if the vagus nerve isn't strong, you're not going to have as much stomach acid. And I know, like, too, another kind of thing that makes me cringe thinking about it, but like vagotomies, being done to stop stomach acid, like makes me cringe, but they were done. Like if they wanted someone to not produce stomach acid, they used to cut the vagus nerve. Oh, that
Why
burns
not?
just.
Why not?
I know. Why not just cut the vagus nerve? But it will stop stomach acid completely.
Yeah.
So I mean, it's just such a huge player in so many different areas. And I know we always talk about it, and it might sound like we're beating a dead horse.
But it's that important.
Right. It's that important to have strong vagal tone so that you can produce enough acid.
Yeah.
And it can be something too, again, I always like to refer to things as like when in doubt. Like just work on the vagus nerve, or when in doubt, do these certain things.
Yeah.
We can get really wrapped up with, some certain supplements and like what protocol I need to be on. But I do think a lot of times when in doubt, working on your vagus and working on your stress response is a good one to focus on versus trying to kind of go down a rabbit hole of finding supplements. Not that supplements aren't helpful. I just think a lot of times we don't focus enough on them, and we're kind of searching for the it thing like we've talked about in other podcasts. So yeah, prevalent. This is a good one to highlight the vagus for sure.
Yeah. And to be clear too, like for those of you maybe who haven't listened to that episode, or we'll kind of recap for a minute. So really, at least in my opinion, you could correct me if you think I'm wrong, but I think that the vagus nerve, how it's frequently talked about, is kind of like humans trying to use their analytical left brain to give themselves like a really science-y reason to give a shit about stress.
Right.
Honestly, like
for sure.
The temptation is, and I'm sure if we, pulled up stats on Google, people probably Google all day, every day. The more this is talked about, they probably Google best supplements for the vagus nerve, best exercises for the vagus nerve, best essential oil blend for vagus nerve, best whatever for vagus nerve. And it's like we talk about it in the context of the vagus nerve because you're listening to the IBS Freedom podcast. So the vagus nerve is a way that's going to really resonate and like drive this home for you and help you see the relevance of how stress plays out in the body. But honest to God, like you can almost give up the magic hunt, or the hunt for the magical item that's going to be like curative or perfect for your vagus nerve. Really, a lot of it boils down to habits and stress and sleep.
Right.
End of story.
Right.
Like you don't need a fancy schmancy vagus nerve supplement 9 times out of 10. You just need to work on stress and sleep. But again, you tell people that, especially if you've been chronically unwell for many, many years, and it can be almost triggering for them, like because other doctors have told them, oh, you're fine, you're just stressed, or oh, you're fine, it's just anxiety, or oh, it's just depression, you need a PPI, or not, you need an SSRI, or oh, you need Xanax, or you need what, or you just need to relax. And it can come off like really assholey when doctors say that. I've had a lot of patients experience that, and then I think a lot of people get really defensive about the stress thing. Because they're like, no, it's not just stress. Like that awful GI doctor told me I was just stressed, but it's not stress. There's something really wrong with me, damn it. It's like,
right.
Yeah, but also stress is kind of a big freaking deal. But the thing is, like, there's no good test for us to say, oh, just get this one blood test done or this one adrenal test done and you're good to go. It's not that simple to really evaluate. So just know that as we talk about the vagus nerve, the thing you can do in the moment for your vagus nerve is eating meals at approximately the same time every day, chewing your food, and experiencing your food. Mindful eating. You could Google that and come up with a bunch of great stuff. So mindful eating and eating at approximately the same time is going to be what you could do in the moment. But the long-term strategy for nurturing your vagus nerve and making sure it's healthy and functioning, and the gut-brain axis, the long-term strategy is anything you could do to mitigate stress or deal with stress. And making sure that you're sleeping also.
Yeah, 100%. What I have 2 main things just to jump off what you were just saying. First, I think one other potential thing that people could do prior to eating to help with vagal tone is just like a few minutes of breath work before eating their meals, especially if you want a little bit of a digestive boost. I do think that can help kind of over time if you're doing some breath work with your meals. It's a good way to set a habit too. I think if you're stacking habits, it tends to help with consistency. Like if you know you're going to eat breakfast, lunch, and dinner each day, it can be a good way to remind you to do some breath work. So sometimes I'll have people do like 2 to 5 minutes of breath work before their meal, 2 to 3 times a day. And I've heard from people that sometimes that just in and of itself can be a digestive booster. So I really like that approach. I also think what you're saying is really interesting about the vagus nerve being almost like a more sciencey way for people to manage their stress. And I think just in general as a society, we don't really value stress management, which I know we've talked a ton about. But I think like people probably can wrap their head more around doing vagal exercises because it's a brain nervous system thing.
It's versus science. It's sexy. Right, it's glamorous.
Right. But it does come down to, how full is your bucket and how can you pull things out of your bucket that don't need to be there? And how can you make your bucket bigger, like build your tolerance to stress? So it definitely takes a multi-pronged strategy too, I think, from a stress management standpoint. I like that you are saying doing consistent meals and doing in working on sleep as being really important, because I think sometimes when we think about stress or vagal tone, those aren't necessarily the first on the list. Like eating consistent meals, I don't think people really match with managing stress or doing vagal tone work. But I think that if you're not eating at consistent times, it's a very physical stressor. We tend to think of emotional, mental stressors as being stressful. So I think those are really key to point out, just because they sometimes slip under the radar as being a stressor because they're not necessarily mental or emotionally stressful, but they're still they can be very stressful on the body if you're kind of an erratic eater, an erratic sleeper. So yeah, I'm glad you were able to point those out.
Well, and it's a symptom, right? Like, and I'll use myself, unfortunately, as an example for today. So I will divulge this.
Excellent. So, I like this.
Remember guys, we're not perfect. So on any given day, I usually have a fairly normal routine of like, like wake up around 7 or 7:15, get my daughter out the door for preschool. I'm usually in the office by 9ish. I'm usually doing my first appointment at like 9:30 or 10. Lunch, I have blocked off every day from 12 to 1. And then, we're usually eating dinner by 5:30 or 6. For today, getting back into the swing of things with the new year still, I don't know, like I texted you and was like, hey, can we start recording a little bit later than planned? I need to make a Costco run. Well, my lunch routine was all shit because of that, because I had put too many things on my plate and I was like, oh, I could squeeze in a Costco run today because like I wasn't valuing my own rest and recovery and time or whatever, and we really needed detergent. But, I was like, oh, I could squeeze this in. And that's where you get trapped in these situations where you're eating at weird, erratic times and you're scarfing down your food. So what did I do? I did not eat lunch. And then I had like a pseudo lunch in the parking lot of Costco in my car. That guacamole never tasted better though.
Aww.
But, I normally would eat at like noon, but because I was making this random Costco run in the middle of the day, I ate at like 1:45 or something. I was like, and I laughed because I was like, this is going to come up on the podcast at some point. But, it's oftentimes not prioritizing the time and the ability to have a consistent meal is a symptom of the fact that you're putting too much on your plate and you're stressed.
Right.
So I think that's a piece of it, is like, you don't want to approach that piece of information as like, all right, I just need to be ultra strict and make this like a regimented, stressful part of my life. It's like, acknowledge it for what it is. If you're having a hard time scheduling regular meals, that probably is telling you that you're stressed and overworked and overwhelmed. And like, you need to kind of approach that in with a little bit of grace and a little bit of understanding for yourself. But yeah, and I think particularly in America, people not only don't care about stress, but I think consciously put it on the back burner and have this mentality of like, if you acknowledge stress, or if you're working on stress, or if you do quote unquote self-care, you're a weakling or you're basic. So it's really hard to unravel that. I'm still working on it myself for sure. But the vagus nerve idea, the one thing that drives me bonkers is that the more experts, including ourselves, talk about the vagus nerve, the more of a temptation it is for people to think, oh, okay, so my vagus nerve is just broken. Cool. Yeah. I need to fix it. I need to figure it out. I need to conquer the vagus nerve. And it's like that overbearing kind of like masculine energy is not the energy of healing. You don't need to conquer your vagus nerve. You don't need to whip it into shape. You don't need to stimulate it. You don't need to push it, or I don't know what other words I could use. You need to have some understanding for what the vagus nerve is going through and try to genuinely get yourself into a rest and digest mode rather than trying to muscle your way and force your way into a rest and digest mode. That's not the same thing. Like, you can't force yourself into a meditative state, right? Like the sheer act of forcing means that you will never achieve that meditative state. And you can't force yourself to sleep and like grit your teeth to sleep. And similarly, you can't force yourself to get into rest and digest mode. You really just have to figure out a way to embody that. And it could take a lot of self-exploration and work.
Right. I think that it's super important to know, like, again, I'm not perfect either. Like, I definitely am not hitting consistent meal times every single day. Like, there's definitely days where there's some flexibility in the day and I'm not hitting the normal dinner time or normal lunchtime or whatever. And I think the way that I would try to frame it is try to focus on progress versus like perfection. I think that that's a much better way, because trying to get to a perfect, consistent meal times every single day and having that pressure can create more stress. So there's a level of understanding. There's some flexibility in these tips and tools that you can use. And I think, again, you're so right on with taking if you feel like you just are not like an erratic eater and you've always kind of been that way, and in finding time to have meals is really challenging. I think that's a really good indicator that like you're the person that needs the lunch breaks. Like, you need that time to reset. Right. And I've definitely had conversations with many clients who just have never taken a lunch break, or like, and I find that a lot of times, like I've seen this multiple times with people that are hairstylists, or like that they're kind of like on the go all day, and like it's like a scheduling type thing where, they're seeing a client after client after client after client. And then they're kind of grabbing like a little handful of nuts or something in between clients, and they never have like a time to recharge throughout the day. I think it's really hard if you've been in that sort of schedule or structure for as long as you can remember to take a lunch break. But what I have seen from people that haven't taken lunch breaks, and we've really kind of worked on how are we going to kind of manage some sort of break in your day, some sort of 30-minute break for you to just kind of rest and recharge. It's been really helpful and impactful. And it's not even just about kind of eating and digestion itself. I think there is like a very like recharging thing that happens when you're able to get in a good lunch break, and it helps you become a little bit more productive and things like that and energized. So, I mean, I can't go about without my lunch breaks. Again, maybe the schedule gets a little bit wonky, but I just couldn't imagine like skipping lunch for a whole day. But people do it. Again, I'm just talking. I've definitely in my past, like early on when I was kind of a teen, I definitely like feel like there were meals skipped. And again, I think family members too, it's like always interesting for me to to watch the meal patterns of my family members, and I'm like, oh my gosh, like, how did you go the whole day with like a Coke and nothing else? Like there's definitely, I can kind of see the meal patterns, and it does seem to be associated with stress levels. Yeah. Like meal patterns of the people that I'm watching, there's like a strong association with, okay, if you're kind of, going by with having like a coffee through the whole day and then eating at night, or like a bigger dinner or something like that, or really erratically just kind of snacking throughout the day, not really taking time to have a meal. Usually there's a lot of stress happening, whether it's kind of work stress, life stress. But you're totally right. I think kind of realizing that that's a sign that you need some time to recharge and time to have to establish optimize your meal patterns, essentially, I think is a really helpful tip.
Yeah. And I think for some people it's a matter of, I guess you could use the word priorities, or you could use the word boundaries too.
Yeah.
Like, I think that there's a lot of people, and I'm thinking of one patient, for example, like she's got 2 kids and she's, carting them here and there all over Tarnation, and she's, going to the grocery store, and she's running errands, and she's in like mom mode so much. And then I think that fills up the day.
Right.
So when we talk, there's oftentimes these conversations of like, can I have this one granola bar every single day for the rest of my life for breakfast? Because that's easy and it's quick, and like,
right.
And she's very much always looking for, okay, could this be my lunch literally every day for the rest of my life? Because it's quick and easy, and I won't have to think about it. And I'm like, I'm trying to like not overstep my bounds in my profession. Like, I'm not a therapist, but I'm also trying to, gently show her like, maybe you could carve some more time out for yourself to have a proper lunch or cook a proper breakfast. And like, I know you feel pulled in a million directions and like you have all these obligations, but also you're worth it. You get to have
oh my gosh, I'm so glad you said it. It's like, I just always think like you deserve a lunch break.
Yeah.
Everyone deserves a lunch break. That's kind of what
that
my
could be a
discussions
t-shirt
too. I know. You deserve a lunch break. That should definitely be a t-shirt.
Oh, we could do the
like
Oprah meme.
Oh, yes.
You deserve a lunch break. You deserve a lunch break. Oh, I am designing that. Oh, I can't wait.
I'm
you
just
guys wait till we get a
imagining.
store up and running.
I'm also imagining us going to like a crowded area and just yelling at people. You deserve a lunch break. And you deserve a lunch break. And maybe throwing like some sort of lunch at them.
Yeah, but then I would be tempted to not throw like a granola bar or something. I would want to throw them like, a plate.
Yeah, a full lunch.
Food. And tell them, now make sure you chew.
Right.
You're worth it.
Right.
Love yourself. Yes, I like this vision.
You need to get like a motivational tape going for when people eat.
Yes.
Like a experience with Dr. Nikki as a motivational tape.
And can we please put this on VHS and make it look like, like all the graphics, could we make it look like it was created in the 1990s? Like the intro and stuff?
For sure. Yes. We can do it however you want.
Perfect. Okay, done. We'll work on that ASAP. All right, so at the risk of digressing, which we totally did, but it was worth it. Okay. Root causes, lab tests, symptoms. Let's pause for one. I think the last real big bullet point that we need to cover is supplementing with betaine HCl. Mm-hmm. And we mentioned bitters too. Bitters can be useful. I think we talked about this last time. Like, I'm not a huge fan. I despise anything bitter. Amy is a weirdo. She likes bitter taste.
I like bitters.
Yeah, so you could there's a lot of different products. Some of them are sprays, some of them are liquids. There's even a tablet by MediHerb that some people really like. So you can get a lot of traction out of bitters. A lot of people just go right for the moneymaker and go for the betaine HCl. Yeah. The way that I do have people test for low stomach acid when I bring it up is I will have them slowly increase the dose of betaine HCl until they get to a point where they have reflux. So I would have you, so for example, if I was telling you, Amy, I would have you start off with 1 capsule of betaine HCl at breakfast, lunch, dinner. I kind of draw it out a little bit more than most do. Stay at that dose of 1 capsule per meal for the entire day, unless you get reflux, then you can stop. If nothing happens and you don't feel any different, the next day you take 2 with breakfast, 2 with lunch, 2 with dinner. If nothing happens, you go up and you take 3. And you keep progressing. I usually cap people, like if you don't feel anything by the time you get to like 8 pills, whatever, just call it a day. But I do have people play with it a bit up until that point. And that way, the idea is that if you got up to 6 capsules with no reflux, and then your 7th capsule caused reflux, the idea is that, okay, you must have low stomach acid, and therefore your maintenance dose is going to be the dose that caused reflux minus 1. So if 7 caused reflux, but 6 was fine, your maintenance dose becomes 6 per meal. It's really impractical and unappealing for most people to take that many freaking pills every single day. So ideally, usually I'll have people start off with that exploration just to get an idea of whether or not this is the thing for them. And then once we establish the number, whether it's absurd or if it's a little bit more doable, if it's like 2 per meal, then we'll say, okay, now our goal is to get you off of that supplementation using these other strategies and these more long-term things. And eventually your body is going to start telling you that 6 is too much. And after a couple weeks or a month or 2, you're going to get reflux from your 6 pill dose, at which case you bump it down to 5. And then your body will tell you again. And then you bump it down to 4. And then you keep whittling it down until you no longer need that supplementation. So that's usually how I have people test. And then I also tell people too, the other thing to keep a lookout for is changes in other symptoms. So you could do this test and hyper-focus on the reflux and try to get to that magic number that causes reflux. But if you also notice along the way, like say in this case, say 6 was fine, 7 caused reflux for you. Well, what if the day that you took 4 capsules per meal, you noticed your bloating was diminished? That's pretty cool.
Yeah.
Please take note of that. And then say if that change in your bloating did not change between 4 and 7. Like, all right, well, I would be inclined then to say, all right, just take 4 capsules per meal, because that's where you found the symptomatic benefit. And it's halfway to that maximum dose that you reached to get the reflux anyway. And also now let's work on the other stuff we talked about. So pay attention to other stuff. It might be that your bloating gets better. It might be that you have like champion poops. It might be, that you have less abdominal pain. Like, keep your eyes out for other symptoms other than just the presence or absence of acid reflux, and see whether or not other things are changing. And then you can base your long-term supplementation plan off of that. And then, like I said, the long game is ultimately getting you off of the supplements by working on the mindful eating and the meal timing and the stress and the vagus nerve and all that crap. That's usually how I do it.
Yeah, I think similarly. So for me, I tend to probably do, and I think that I'm not sure again how you're structuring that. So I tend to like to focus in on some of the the chewing, trying to see if symptoms kind of change from some of the basic things. So kind of, I try to focus on the bases, the basic bases that we've talked about here. And then, and then if things aren't necessarily progressing, I might start with bitters too. Sometimes that's something I do start with. So if I'm suspecting they might have lower stomach acid, and we might start them on bitters. We might start them doing really paying attention to chewing, really paying attention to meal patterns, really paying attention to stress and vagal tone and those sorts of things. And then I might kind of see where they're at, and at that point I might do some HCl. So in a similar way, I think we're definitely focusing on very similar things. My only maybe slight difference is I kind of like focusing on the bases a little bit first, but I think we just reverse the order a little bit. Right, exactly. And again, there's not necessarily a right or wrong way to do it either, but truthfully, I like your way better in a sense, and I'm going to defend my own method also. But truthfully,
deep in my heart of hearts, I prefer your method. Like, I like the idea of going for like the cheap or free lifestyle-ish type stuff first. The reason I do what I do is because I do sometimes feel a sense of
I know what you're going to say, like urgency.
Well, urgency, there's that element of like people want to feel better yesterday.
Right.
And it's much quicker gratification if we do the HCl challenge and people learn that about themselves right at the get-go. And to them, it feels very sciencey too.
Right.
So there's some appeal, like I think it legitimizes this idea to people, and it is more instant gratification-y. And, you know, and I'm always worried too, like I'm pretty chill as far as like how I work with people. I don't really do giant packages, and I'm like, you know, follow up when you need me.
Yeah.
You're in control of this, and I'm here for you whenever I can be. And I know that also, for all that that's like a good way to do business, I think, it also means that people can have a little bit of like ADHD on me. And like, you know, if they start working with this new practitioner, and then if they don't feel any difference within a month or two, they might be like, she sucked, and move on to the next person.
Right.
And I want that person to understand, like, no, I have a pretty good grapple of what's going on with you. It might just take you a while to get there.
Right.
So I want to give them some wins in the beginning.
Right.
And not like lose them as a patient. I want to like see this through to fruition. And I think part of me, whether it's accurate or not, part of me worries that if I have them focusing on those things and some of the slower gratification stuff, they're going to get too impatient with me and be like, whatever. She didn't cure me fast enough. She didn't fix me fast enough. And they're going to leave.
Right.
And then I'm like, no, we were so close.
Right. No, I totally understand that. I think too, like, if someone came to me and was like, again, we're suspecting low stomach acid, and they were like, I really want to try HCl, I don't think I'd be like, no, we have to do it in this order, or like,
not allowed.
Or if, again, they were like, you know what, I tried HCl in the past and that seemed to help, like, that was one thing that really helped. Like, again, I'm not going to be like a stickler or anything about like one way or the other, but I just would say, like, sometimes, again, like the thing, I just want to make sure that we're not kind of missing bases. So that's, but I totally get your thing first. I think getting kind of more instant wins, if that's a bigger problem, makes sense too.
I think my method has a little bit more telling to do about like my internal baggage and workings, things things that I worry about and cart around all day. But again, I like your method. I think that's like the good, like, freer way to be. I just need to release some of my baggage of like, people are going to hate me if I don't cure them in 2 months. They're going to leave me. So
I mean, it is hard.
Hashtag fear of abandonment.
Right. It is hard. Again, like, I've definitely struggled with that too as a practitioner. I mean, and part of it is that I think with the conventional, our whole lives, we've been getting commercials from conventional medicine saying, like, you just need this pill. And of course, I love how on commercials, like, the part where they describe the benefits, like, so loud, and then, like, the negative, like, this could cause, like, super fast and low tone. So I think we've been hearing that all our lives and been exposed to so much instant gratification just as a culture. So it's really hard, I think, to combat that as well. So, I mean, I get it. It's definitely something that sometimes I definitely am like, whoa, like, we're kind of a couple months in, we're sort of at a plateau. Do we need to shake things up, or how do we make this quicker? So I definitely understand that from what you're saying.
Yeah. But I think that covered a lot of the bases.
Yeah.
I want to wrap up, or at least on my end, this is the last thing that comes to mind, with a quick little anecdote about a patient of mine. And this is something like, ultimately, the choice is yours, right? Like, we can have all of this wonderful advice, but ultimately it's your decision how you're going to implement this. You could be sitting there and be like, no, man, stress isn't a big deal for me, and I want to eat whatever I want. I'm just going to take the HCl. That's you, dude. Like, you do you.
Yeah.
But we're just telling you, like, how we would prioritize it and how we would do it and what we've seen be most effective in our clinical practices. But I'll wrap with an anecdote of a patient. So she had SIBO for quite a while. I don't remember the stats here, but she had SIBO for a long time. And she had done multiple rounds of antimicrobials. If I remember correctly, this patient had done rifaximin several times. She had done the Candibactin AR and BR combo numerous times. Side note, she's like one of 2 patients I've ever had who actually liked Candibactin AR and BR. Most of the times that I've talked to people who have tried it, they're very like, meh, or they didn't think it was effective. So side note, but she like really liked the Candibactins, and they made her feel good, and she felt like she was treating it. But every time she came off the antimicrobials, and I'm using kind of air quotes because we never really did a lot of repeat testing to super confirm this, but she felt like the SIBO would come back. Mm-hmm. And she would have, loose stools, a lot of bloating. And we had gradually chipped away at various other things. Like, I think maybe probiotics or prokinetics, dietary stuff. Like, I forget exactly. But I had this sense from, I think, day one of working with her, that she had more stress than maybe she always let on. Or maybe that she was consciously willing to accept. And she's got like 2 kids, and they're very active in sports. I mean, pre-COVID. But they were incredibly active in sports, and she like worked, and she was always just like pulled in a million directions with family and work and life. And I got the impression that she had a lot of stress and anxiety, but she wasn't really being honest with herself about a lot of that. And what's kind of funny about this, and why I bring this up, is that the thing that ultimately helped her tremendously, again, like, we had made good progress, and she was doing quite a lot better, but she wasn't fully cured of her SIBO, and it wasn't staying away. But when we had her do the Betaine HCl challenge, that was like, oh, the angels sing. It was amazing. And she reported back to me a few months later, and she was like, I have not had an IBS flare. I haven't had loose stools or bloating in 3 months. It's amazing. Yeah. And this was a woman, like, she couldn't go more than a couple of days without a little bit of a flare.
Yeah.
And was singing the praises of Betaine HCl supplementation. I was like, that's great. And I tried to gradually open the door to the conversation of, well, hey, here's how you could make DIY stomach acid. Let's talk about stress and the fact that you're pulled in a million different directions. And I don't remember exactly how it went, but it was this follow-up appointment was like a year and a half ago, so I don't remember anymore. But I remember getting the distinct impression that if we had a real open heart-to-heart about it, I think she would have said, no, I don't want to deal with the stress stuff. I want to keep living my crazy life, being overworked and pulled in a million different directions and on the go. I just want to take a pill.
Right.
And that made her happy. And that was her thing. So, like, she continues to work the job that stresses her out and cart her kids around to 8 million soccer games or whatever. I think, like, both of her kids were in like 2 or 3 different sports at any given time. Like, I mean, she wanted to maintain her life as it was with, 6 betaine HCl pills per day.
Right.
It's like, okay. I don't know. I think I would be more open-minded to changing your life. But if for whatever reason you're not in a place where you want to do that and that's not appealing to you, it's your choice. You can take betaine HCl from now until doomsday. It's fine. But I just like want to let you know that there is an alternative. And it is harder because it involves a lot of like self-work and self-discovery and like priorities and, maybe some tough conversations with people you love and like boundaries, and like that's tough. But also it's probably going to have more far-reaching rewards in your life as opposed to just taking a pill and being done with it. But it's her choice, her life. So to the best of my knowledge, she's still taking a whole truckload of betaine HCl every day, but she's happy and she's free of SIBO. So, it is what it is.
Yeah. I think, again, like, the good thing is that you planted the seed. I think at some point, stress catches up to you. And so the best that you can do as a practitioner is to plant the seeds. And at some point, again, she'll remember, oh my gosh, like I remember like talking to Nikki and she was saying that I'm stressed and I really needed to work on that. Because I do think, again, like band-aiding things is definitely okay for a period of time. And if that's kind of your prerogative, then that's your prerogative. But I do think at some point, unfortunately, stress does seem to like catch up to you maybe in a different way other than digestively. If you're kind of supplementing well and that seems to be working digestively, maybe it's some other way that stress kind of is coming into play. But yeah, it's always, I think it's always hard, I think, when you have those clients or patients that just like are not seeing what you're seeing. And maybe they'll probably see it in due time. And so I think it's one of those things where you just kind of plant the seed and hopefully they revisit it at some other point. Yeah.
Yeah. And you just, as a practitioner, I feel like all we could do is hold space for them and
100%.
Hope that they ultimately do what makes them feel best and like live their best life. And I don't know every inner working of her life, and there could be a good reason why she doesn't want to kind of open up Pandora's box of her life and change things around.
100%.
But, I'm not going to cast judgment on it, but for the record, I would be more receptive to doing life changes and prioritizing some self-care and prioritizing a little bit more me time if I was in that position. But it is what it is.
Yeah, for sure.
All right. Well, my dearest, do we have any other tidbits on the low stomach acid front? I feel like we've covered it all.
Yeah, we've run the gamut.
Yeah, we talked symptoms. We talked testing for low stomach acid, root causes, vagus nerve. I feel like that's about it. Guys, let us know if we left something out. I feel like we covered pretty much all of the bases to the degree that we could. So if there's something else that's really paining your soul that you need to know about low stomach acid, feel free to email us at ibsfreedompod@gmail.com or comment in the YouTube video down below if you're on YouTube, or send us a message at ibs.freedom.podcast on the Instagram. But that's about a wrap. So as per our usual, this is the point where I ask you to please review our podcast and share it with the world, share it with your friends, because that would help us reach more people and cure the world of IBS and just, get the word out. So if you wouldn't mind, go ahead and rate us 5 stars if you are on a podcasting app. If you're watching us on YouTube, go ahead and click like, subscribe, ring the bell, comment down below, do what you need to do on YouTube to keep up to date on our updates. And we will plan to see you in the next podcast. Amy, 'twas a pleasure as always, my dear.
Yeah.
We will see you in the next episode.